Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, today in this video we can discuss the questions from medical and surgical nursing and we can see the important points also. Friends, my humble request is to like my videos and subscribe my channel and support me to do more videos. We will see the question one by one. The first question, who is the father of medicine? And the options are option A Sushruta, option B Hippocrates, option C Charaka, and option D none of this. Here, question is who is the father of medicine? So the answer is option B. Hippocrates is the correct answer. Hippocrates is the father of medicine. And the remaining option we can see the first option, Susruta. Susruta is the father of Indian surgery. And Charaka. Charaka is the father of Indian medicine and Ayurvedic medicine. And Hippocrates. Hippocrates is the father of medicine. Susruta, Charaka and Hippocrates. Here our question is who is the father of medicines? Option B, Hippocrates is the correct answer. And we'll see the next question. Second question. Who is the father of surgery? And the options are option A Charaka, option B Sushruta, option C Hippocrates, option D Dhanvantari. We already discussed in the first question. Here, father of surgery is the question. Father of surgery is Susruta. And Charaka is father of Indian medicine and father of Indian surgery is Susruta and father of medicine is Hippocrates. So here question is father of surgery. Option B, Susruta is the correct answer. The next question, all are risk factors for pulmonary embolism except. And the options are option A obesity, option B DVT, option C anemia, option D surgery. Here our question is which among the following is not a risk factor of pulmonary embolism. So here the correct answer will come option C anemia is the correct answer. Pulmonary embolism means is a blood clot that block the blood flow to an artery in the lungs. So blood flow is decreased here in lungs. Okay, here the risk factors of pulmonary embolism are pregnancy, prolonged bed rest, deep vein thrombosis, obesity, surgery are some of the risk factors of pulmonary embolism. Among our option, anemia is not the risk factors of pulmonary embolism. Remaining pregnancy, prolonged bed rest, DVT, obesity, surgery are the risk factors of pulmonary embolism. So option C, anemia is the correct answer. We'll see the next question. Fourth question. Following are the favorable factors of wound healing except. Options are option A young age, option B an adequate blood supply, option C excessive use of corticosteroid, option D minimal tissue destruction. Here our question is which among the following is not the favorable factors for wound healing, that is the question. So here correct answer is excessive use of corticosteroid is not a favorable factors of wound healing. It will not help to heal the wound. Excessive use of corticosteroid. We will see the factors affecting wound healing process. They are favorable and unfavorable factors are there. We will see the favorable factors. First one is young age, second is an adequate blood supply to the area, and third is good general health, and fourth is adequate nutritional intake, especially protein and vitamin C, and minimal tissue destruction, and absence of infection, and use of anti-infective agent, and immobilization and rest to the particular area, and presence of tissue that are capable of regeneration of new tissue. That these are all the favorable factors of wound healing. Here Excessive use of corticosteroid is not a favorable factors, and also unfavorable factors include old age, poor health, inadequate blood supply, presence of diabetes, excessive corticosteroid, presence of infection, presence of foreign bodies, excessive movement of the injured area. These are all some unfavorable factors of wound healing. Fifth question: early warning symptom of laryngeal cancer is. Options are option A hoarseness, option B sore throat, option C airway obstruction, option D all of this. Here our question is, which is the early warning symptom of laryngeal cancer? Okay, here in this option hoarseness of voice is the correct answer. The early warning symptom of laryngeal cancer is hoarseness of voice. Usually, the hoarseness of voice more than 2 weeks will persist, and the voice may be harsh, raspy, and lower in pitch. The nature of voice, and cough, sore throat, pain, and burning in the throat may experience the patient, and the burning sensation when he experience means they are taking hot liquid or vitamin C rich food. That time they will experience burning in the throat, and the later symptoms include dysphagia, difficulty in swallowing, dyspnea, and persistent hoarseness of voice, foul breath, cervical lymphadenopathy, and unilateral weight loss, and pain radiating to ear with metastasis. These are all the later symptoms. Here our question is, which is the early warning symptom of laryngeal cancer? Is option A, hoarseness. A nurse is preparing to insert a nasogastric tube into a client. The nurse placed the client in which position for insertion? Options are option A, right side, option B, low Fowler's position, option C, high Fowler's position, option D, supine with the head flat. Okay, here question is, during the nasogastric tube insertion, the nurse should place the client in which position? This is the question. So here, during the insertion of nasogastric tube, the client position the client in a high Fowler's position with head tilted to forward. So here answer is option C, high Fowler's position. So position the client in a high Fowler's position with head tilted to forward. This position reduces the risk of pulmonary aspiration. Okay, if the client should omit during the time of insertion, if the client should omit, this Fowler's position will prevent aspiration, prevent pulmonary aspiration. So we should keep the client in a high Fowler's position. Okay, option C is the correct answer. Seventh question, Dewey's criteria is related to which disease? Options are option A, encephalitis, option B, infective endocarditis, option C, hydrocephalus, option D, all of this. Here question is, Dewey's criteria is related to which disease? Okay, answer is option B, infective endocarditis. Dewey's criteria is the one of the diagnostic criteria for endocarditis. Okay, option B is the correct answer, infective endocarditis. We'll see the next question. Eighth question. Nurse is caring for a client following a supratentorial craniotomy in which a large tumor was removed from the left side. Select the position in which the nurse can safely place the client. And the options are option A, on the left side, option B, in a semi-Fowler's position, option C, with the neck flexed, option D, with extreme hip flexion. Here question is, a nurse is caring for a client with supratentorial craniotomy on left side, and which position can give safely for this patient? This is the question. So here, a client who have undergone supratentorial surgery should have the head of the bed should be elevated 30 degree. Okay, that is semi-Fowler's position. That is the correct answer. So head of the bed should be elevated 30 degree to promote venous drainage from the head. and also the client is positioned properly to avoid extreme hip and neck flexion, and the head is maintained in a midline neutral position. So the head is maintained in a midline neutral position. If large tumor has been removed, in our question large tumor on left side it is removed. Okay, so if a large tumor has been removed, the client should be placed on the non-operative side to prevent displacement of the cranial content. Okay, if large tumor is removed, the client should be placed on the non-operative side. Okay, here our question answer is option B, semi-Fowler's position is the correct answer. Patient, the head of the bed should be elevated 30-degree angle. Ninth question, which of the following electrolyte imbalance is seen in SIADH? And the options are option A, hypokalemia, option B, dilutional hyponatremia, option C, hypernatremia, option D, hyperkalemia. Here question is, which electrolyte imbalance is seen in SIADH? So here option B, dilutional hyponatremia is the correct answer. SIADH means syndrome of inappropriate antidiuretic hormone, that is the full form of SIADH. In SIADH there is an excessive antidiuretic hormone that causes a retention of fluid and low sodium level in the blood. So here option B, dilutional hyponatremia, low sodium level in the blood will cause, that is hyponatremia is the correct answer. And we'll see the next question, 10th question. A patient with chronic obstructive pulmonary disease, that is COPD, is prescribed ipratropium bromide. Which of the following is the method of administration of ipratropium bromide? Question and options are option A, administration via injection, administration via inhalation, administration via tablet form, administration via subcutaneous route. Here our question is, for a COPD patient, ipratropium bromide is prescribed, and how the ipratropium bromide will give to the patient? That is the question, and answer is option B, administration via inhalation. So this ipratropium bromide is a bronchodilator and is used to treat COPD patient, that is chronic obstructive pulmonary disease patient. It is used in COPD patient and it is a bronchodilator, and this is mainly given through an inhalation. Okay, why to give inhalation is to deliver the medicine directly to lungs. It is given through inhalation method. Okay, so here answer option B is the correct answer.